Hey guys, it's Jeanette. Hope you guys are doing well. Happy Monday. I just finished clinical day 5 and although the weather is bad, I did really well today. So I am super excited. So this week I ended up doing a lot of prep work for my clinical day today. Today we were working on, well, last week we were working on a primary nursing diagnosis, collecting subjective and objective data, and then let's see, thinking about a possible goal that we want the patient to achieve. So a lot of the prep work had to do with, modifying and strengthening my nursing diagnosis, finding suitable and achievable goals that I can make with the patient. So I did a lot of the prep work. I typed a lot of things up, so all I had to do was just handwrite it onto my documentation. And I also did my sticky note thing where I just list the skills that I want to practice or do during the shift, and that helped me to keep moving along. Most of my packet was completed before actually going there, so I just did my nursing notes, my nurse's notes. I did I collected subjective and objective data, when I did the head to toe. And then I did most of my work on the nursing care plan. So from actually implementing some of the interventions to evaluating whether the plan has worked, whether the patient has met the goal, etc. So it was good. My patient, I got a little sad because my patient's being discharged tomorrow and the person will get to go home, which is super sweet. But just the idea that I'll be there and they won't, it's a little sad. So also today, some of my classmates, their patients from last week passed away. So that's difficult because, one, the person has passed away, of course. But for us, if you do a lot of the prep work, you pre-fill your documentation until you get there and you modify and you change things just to make things easier. A few of them had to actually start all over, and last week we chose a patient, we assessed them, we thought about their primary nursing diagnosis, we came up with some goals, we did the head to toe and assessed and gathered as much data as possible. So now they had to go and find a new patient and do all of that. But I'm happy that I was able to complete my documentation. I feel good about it. There are always things that I wish I could improve, but with the time constraint, I think I did pretty well. Again, I'm going to miss my patient. It was a wonderful experience to have someone who's so willing to be the patient and allow you to talk and practice your skills, and the person really understood that, and I was just really grateful. I can't say that I have classmates that have had those type of patients. From what I hear, some of them are just like, do it quickly or don't do it at all. So that's difficult, just finding someone, especially since we're so brand new to just patient interaction, practicing skills on real people, etc. So I'm just happy that's, I got someone that was good. Anyways, so let's see. So for clinical, you know how I talk about the sticky note and just writing down everything I want to complete. I got a lot of things today, so I think I'm missing maybe 5 to 10 more, signatures confirming that I've done this skill. And I also wanted to say, so I've made, friends with some of the nurses' aides and the nurses, and that's really important. Sometimes they'll just have a moment where they don't want to be sitting at their desk and like, okay, let's go bang out a few of these skills, and she'll go and just drag me around and teach me and let me do, and I thought that was fabulous. So she really helped me today. And then my teacher also said that everyone should treat working in clinicals like a job interview. A lot of the nurses, the charge nurse, the DON, I mean, they could come back and speak to the teacher on your performance, that's always nice, to just have someone look, evaluate, and then go back to your teacher saying that you know what you're doing and that you're doing a good job. So let's see. So it's really nice to have some positive feedback from those that work there, especially because you are a new student, and just having them watch you and teach you, and it's just a nice experience. So that's that. Let's see. The last thing is today I shaved an elderly male, like his beard, and that was tough. You know, just because of the skin, you have to hold it taut, and then I was just afraid of hurting the patient. And then in my head it's like, well, shaving's pretty easy, but it's really not when you're doing it on someone else. And then I have no idea how men get so close without like cutting their lips. So you know, I was working with this CNA, and so we were able to complete it, but it was just tough. But overall, this first round of clinicals has been really nice. It has been stressful. Hasn't always been nice. I mean, I dreaded days going. I'm afraid I'm gonna mess up. I found myself just standing around trying to figure out what to do. But I've seen, and I feel like I've grown a lot. Again, the more I'm there, the more comfortable I am doing things. So I can see with all of the experience that we'll be having, that will really help me build my confidence and just be a better nurse as the program goes on. And then eventually I'll be a good nurse when I am out of school and just working as one. And again, every time that I'm with the patient, I just try to improve whatever I do. And that's just the stage where I'm at. I've been just kind of thinking about the process or the phase of where I'm at in terms of I'm a student. I should really get out in my head that I'm supposed to be 100% sure on everything, that I'm supposed to do everything correctly, that I'm supposed to just know it all. I don't. So I've been thinking about that recently, and I'm at a point where, yeah, I'm a student. I want to learn, teach me, correct me, because I don't know it all. I barely know anything. But and then another thing today, the resident I was caring for, we were discussing the importance of keeping a very positive attitude. The person was being discharged, and I had to tell the person that, you know, keep up the positive attitude. That will get you far. And we both agreed that it is important in whatever that you do, just to keep a positive mind. Well, I think that's about it. I have health assessment final Wednesday, so I will be studying, and I just can't believe the semester's almost over. So I think last week was week 13, if I'm not mistaken. Yeah. Anyways, my last day is May 6th, and I just can't wait. Well, anyways, hope you guys have a good one. Have a good start to your week. If you have any questions, feel free to leave in the comments below, or you can tweet me or Instagram me or send me an email, whatever. Well, I guess that's about it. Yeah. Bye.